Hey, how you doing? This is Doug from Medical. This time I'm going to talk about shoulder dislocation reduction in athlete. What you need to know. Okay, so I mentioned about this one point. I do not like to see middle school, high school football player or freshman high school football player come off the field holding the shoulder. Well, the reason is because their growth plate is still this humerus, and then growth plate is still wide open. So sometimes, and they crack through or halfway, fracture. And if you are not sure, and if you, let's say you think it's a dislocation, which is not, and you're trying to do traction, then you're just gonna crack through it. Okay, so that's why I do not like that age group. And I support if you're gonna play football, yes, but when they come off the field, the shoulder, that's the part I really scared, worry, concerned, when I see it. So that's one of the things. Another thing is the nerve damage. People always worry about the nerve damage. There's axillary nerve from the front part of the shoulder. When they dislocate, they pinch or somehow they damage the nerve. And yes, that's sort of the concern. It happens all the time. I was reading an article that about 11 or 12% of the case. So it doesn't happen all the time, but it happens. But for that situation, that you should have the system to protect yourself. Okay, let's say you're in a high school setting, and I was there for 20 years, and I came up with my own. So I need to make sure before football games start, I need to know who's going to be the administrative assistant, or usually principal, vice principal, and then ask or tell them, okay, something happened. If I need to talk to the parents, if I point it to you or give you a sign, please come sit and I'll stand right next to me, be the witness what I say to the parents. Okay, so I go through the steps. And before actual reduction, of course, yes, we skip the x-ray because I don't have access to the x-ray. Okay, just do my own steps, and then talk to the parents. Okay, underage. Okay, just I pinch his deltoid muscle, trying to ask him to raise him. He'll raise the arm, but he cannot. Okay, which means what? Most likely nerve damage. So you need to say, okay, the nerve damage is done. Okay, so you need to mention. Okay, then you offer, okay, I can try to reduce it or go to the emergency room. Okay, and then you reduce if parents say, please reduce. Okay, so the step is very important. Okay, because if you don't, and they can come after you later and say, well, I think the trainer damaged my son's, the nerve when he reduced it, which, the dislocation caused the damage, not the reduction. Okay, the doctor can tell you that. I know that, but the parents, they don't know that, and they can come after you. Okay, they really can. Even though they think they're right. Okay, even though they're not. Okay, so if you do the step what I did, bring the witness, make sure to be the witness what I say to the parents before the actual reduction, which will protect you. It's going to protect you 100%. It doesn't. Okay, it's unfortunate, but it doesn't. But it, just you mentioned you're ready, so do your part. Okay, so that's something I do, and that's something you should know. You should do. Okay, so that's my approach to the shoulder dislocation. Younger age, if I put my hands on the humerus head and then trying to ask, kind of do internal rotation, external rotation. If I feel any clicking, then stop. Put on the sling, send it to the emergency room. Okay, but axillary nerve, possible. Have a witness, protect yourself. And so that's my two things. So, all right. Thank you.